uterine fibroids, which is sort of in medical land, is also called leiomyomas or simple fibroids. They are benign growths and they develop from the uterus. And they are composed of muscles and fibrous tissue, and they can vary in size to very small size to big size. And location can vary within the uterus. Fibroids are quite common, and with estimates suggesting up to 70 to 80% of women that may develop fibroid by the age of 50. So it's not an uncommon condition. The exact cause of fibroids is unclear up to now, despite all the researches, but hormonal factors, particularly estrogen and progesterone, they play a role in their development. And the following are common symptoms which are associated with fibroids. Heavy bleeding, pelvic pain or pressure, because large fibroids can press against nearby organs, bladder, abdomen. They cause pelvic discomfort, pain, or feeling of pressure. Urinary symptoms. This is because fibroids can push against the bladder, leading to frequent going to the toilet, urgency, or even difficulty emptying the bladder if the compression is on the bladder neck. Of course, constipation and rectal pressure, because fibroids that are located near the colon or at the back or on the rectum may result, in constipation or sensation of rectal pressure. In the same way, there can be back pain or leg pain because fibroids exert pressure on nerves, causing pain in the lower back or even on the legs. And of course, patients feel there's a large abdominal enlargement, feeling pregnant. And large fibroids can cause the abdomen to expand to a great extent, giving the appearance of pregnancy or even noticeable abdominal mass. And when they're very large, patients can actually feel it, except those that are overweight. Infertility or pregnancy complications can occur depending on the size and location. Fibroids that interfere with fertility or leading to complications during pregnancies are those that are located inside the uterus itself. And several factors may increase the risk of developing fibroids. Some of those factors relating to age, because fibroids are very commonly diagnosed in the 30s and 40s, or they can occur at any age. Having a family history of fibroids increases the likelihood of developing them. Ethnicity is quite an important factor because women of African origin, they have a higher risk of developing fibroids compared to women of other ethnic backgrounds. And hormonal factors such as estrogen, progesterone, these are the hormones that regulate the menstrual cycle, and they are believed to promote the growth of the fibroid. Therefore, hormonal imbalances or exposure to high levels of estrogen may increase the risk. Weight, obesity, being overweight or obese is associated with increased risk of fibroids, because most of the time patients who are obese might not even know until it develops into a big size. It is important, however, to note that many women with uterine fibroids may not experience any symptoms at all. And the condition is often discovered during routine pelvic assessment or imaging studies. And if you suspect you have uterine fibroids or experiencing symptoms, it is always best to consult with a health professional for an accurate diagnosis and appropriate management options. Yeah, fibroids can be diagnosed through various methods. Obviously, taking history, like all doctors do, is important. You take a very good clinical history. Pelvic assessment, and during pelvic examination, Your healthcare professional may be able to feel the presence of fibroids by manually examining your womb and the surrounding areas. And this can be more or less supplemented by imaging tests, such as ultrasound scan, which they are commonly used to visualize the uterus and detect the presence, the size, and location of fibroids. Other more expensive imaging techniques like MRI, which is magnetic resonance imaging, or CT, computed tomography scans. This may be used for further evaluation or to gather more detailed information about fibroid. And of course, hysteroscopy. This is passing the camera through the inside of the womb, through the vagina and cervix. It allows the doctor to directly view the inside of the uterus and identify any fibroids that may be present. And once diagnosed, the treatment options for fibroids depend on various factors, including severity of the symptoms, the size and location, desire for future fertility, and individuals' overall health. The available treatment options, this include, if the patient is asymptomatic, watchful waiting is very useful, particularly if the fibroids are very small and they are not causing any significant symptoms and they are not affecting fertility. A watchful waiting approach may be recommended. And this involves regular monitoring of the fibroids to track the growth and the progression of the symptoms. And medications. This may be prescribed to manage symptoms associated with fibroid, particularly pain and heavy menstrual bleeding. The medications that can be used include hormonal contraceptives, such as the birth control patches or intrauterine devices, and non-steroidal anti-inflammatories or other hormone-regulating medications. There are surgical interventions. Minimally invasive procedures are becoming increasingly used. Several minimally invasive procedures can be performed to treat fibroids while preserving the uterus. This include uterine artery embolization. This involves blocking the blood vessels that supply the fibroids, causing them to shrink and to reduce symptoms. These are done usually by radiologists. Mammectomy, which is the surgical removal of fibroids while preserving the uterus, it may be performed using different techniques, such as laparoscopy, passing the camera to the abdomen, hysteroscopy, passing the camera through the inside, through the neck of the womb into the womb, or open abdominal surgery, depending on the size, the location of the fibroids, and the experience of the surgeon. Increasingly, there are radiofrequency ablation. The procedure uses heat delivered through a needle to destroy fibroid tissue. And I think magnetic resonance guided focus ultrasound surgery, called MAFOS. They use focused ultrasound waves to eat and destroy the fibroid tissue, is becoming increasingly used. Surgical interventions might be required as the final result if fibroids are particularly large, causing severe symptoms affecting fertility. A hysterectomy may be recommended. Hysterectomy will involve surgical removal of the uterus and is considered a definitive treatment of fibroids. So the choice of treatment depends on individual circumstances, and this should be discussed with the healthcare provider, who can provide personalized recommendations based on the specific situation, including individual symptoms, desire for future fertility, and of course, overall health. But it is very reassuring to know that most uterine fibroids are benign and they do not cause serious complications. However, in some cases, Fibroids can cause significant health problems and may require medical intervention. Some of the potential complications include heavy menstrual bleeding, if they cause excessive menstrual bleeding relating to anemia and fatigue, pelvic pain and pressure. Large fibroids can press against surrounding organs, including intra-abdominal organs such as the bladder, the rectum, causing pelvic discomfort and pain, and this can cause a lot of pain during intercourse. Infertility, fibroids may interfere with fertility by disrupting the shape or function of the uterus, or even by obstructing the fallopian tubes. Not to forget potential pregnancy complications. Depending on the size and location, they can increase the risk of complications during pregnancy, making normal delivery very difficult, increasing the risk of miscarriage, preterm labor, or even abnormal presentation of the baby, most commonly breech presentation. There are also urinary and bowel problems. Large fibroids, as I said, can push against the bladder or rectum, causing urinary or bowel symptoms such as frequent micturition or urination, urgency or constipation. Anemia can result from heavy bleeding and iron deficiency anemia. Fatigue, weakness, and shortness of breath are symptoms of this anemia. Very rare complications, they can outgrow their blood supply, especially in pregnancy, or they can become twisted or degenerate, causing severe pain or infection. It is important, however, to note that most women with fibroids do not experience significant complications. And fibroids are often discovered incidentally during routine pelvic assessment or imaging studies. However, if you suspect you have fibroids or experiencing symptoms, it is important to consult with a healthcare professional for an accurate diagnosis. And as always, they can provide appropriate management options. Oh, very interesting question. Yes, fibroids can affect fertility by interfering with the shape or function of the uterus, or by obstructing the fallopian tubes, which is the tube that allow the transfer of egg from the ovary into the uterus. Now, so if you are trying to conceive and you have been diagnosed with fibroids, there are a number of things you can consider. First of all, consult with a fertility specialist. If you are trying to conceive for a while without success, it may be helpful to consult with this specialist because they can perform additional tests to determine whether fibroids may be affecting the fertility and recommend appropriate treatment options. Also, you must consider non-invasive treatments, especially if the fibroids are small and not causing fertility. Non-invasive treatments such as medication or watchful waiting may be recommended. The treatment can help and manage symptoms while preserving your fertility. Always useful to discuss surgical options with your doctor, especially if your fibroids are large or it significantly affects fertility. Surgical intervention may be recommended, and this will include mammectomy, which will involve surgical removal of the fibroid itself while preserving the uterus. And it might be an option for women who wish to conceive in the future. It's important to understand the risk during pregnancy, because if you do become pregnant with fibroid, it is important to understand the potential risks and complications. Depending on the location, fibroids may increase the risk of miscarriage, preterm labor, or abnormal presentation such as breech. Close monitoring during pregnancy is essential to ensure the best possible outcome. And if any intervention has been done, such as mammectomy, it's almost certain that your doctor will recommend that you have a cesarean section as mode of delivery. Be patient. Remember that not all fibroids affect fertility, and many women with fibroids are able to conceive and have healthy pregnancies. Be patient and work closely with your GP or healthcare team to determine the best course of action for your individual situation. In general, it is important to work closely with healthcare professionals who specializes in fibroids and fertility to determine the best course of treatment for your individual situation. With appropriate management, many women with fibroids are able to conceive and carry a very healthy pregnancy to term. There have been several recent advancements, both in the treatment and research on fibroids. Some of the latest developments include non-invasive treatments. Newer non-invasive treatment for fibroids, such as magnetic resonance guided focused ultrasound surgery, and the use of radiofrequency ablation are increasingly gaining popularity. And these procedures, they use focused ultrasound waves, or HIT, to destroy fibroid tissue without the need for surgery, offering a very less invasive alternative to traditional surgical interventions. There are also alternative medications. Some of this research has identified potential role for medications such as vitamin D, green tea extract in the treatment of fibroids. While most studies are really necessary, they are needed to validate these findings. They seem to offer potential new avenues for managing fibroids, but they are not in the use in the general domain just yet. There are also genetic research. Researchers are studying the genetic factors that may contribute to the development of fibroids. Why is it commoner in Africans than non-Africans? This research may help to identify new treatment targets and develop personalized treatment options for patients with fibroids. There are also new drug therapies, and several new drugs are currently in development for the treatment of fibroids. The drugs are designed to target the specific hormonal and cellular pathways involved in the growth of the fibroid, and they may offer new treatment options for patients who do not respond to traditional medications. And there's also improved imaging techniques. Advances in imaging techniques such as 3D ultrasound scan, contrast-enhanced MRI are improving the accuracy of fibroid diagnosis and treatment planning. These technologies allow doctors to visualize fibroids more clearly, and they may help better identify the most appropriate treatment options for individual patients. It is important to note that while this advancement in fibroid treatment and research are promising, more research is needed to fully understand their effectiveness and potential risks. As always, it is important to consult with healthcare professionals for an accurate diagnosis and appropriate management options.